how should we protect those so-called the vulnerable, like the seniors, like the kids, and also pregnant ladies and those with chronic health conditions? Dr. Guo.
Yes, for these vulnerables, we think I think the severity of the disease of the COVID-19 is correlated with your immune system and the virus's load that you are contacting. So the first thing you can do is to, if by any chance you should get the vaccination as soon as possible, if you haven't contracted COVID-19. And secondly, you should protect yourself from getting these viruses, such as you should wear N95 masks, or washing your hands very frequently. And also you should keep a window open to keep the ventilation in the room. So I think these are the basic rules for the infectious diseases.
Actually, I believe that most of us has been a while that we didn't meet with our relatives. So we must miss them very much. So fully understand that there's a kind of need for us to travel during the Spring Festival holiday. But also, I just wanted to remind that it's also our responsibility to look after the vulnerable populations that we mentioned before, right? The elderly, the patient with underlying diseases, the pregnant ladies, the newborns, and etc. Well, I might have some tips. The first thing is to make sure that you are in a good condition before you pay a visit to your relatives, especially you knew that there was someone like the elderly, your grandma and grandpa, who used to live alone. And during the Spring Festival, it would be very happy to meet you again, but make sure that yourself is in a good health condition is rule number one. And number two is, if you don't have, or they don't have the contraindication, as Dr. Guo mentioned, if they don't have the contraindications, make sure that they can get a vaccination, as the boost vaccination as well, as soon as possible. I think it's a good way to protect themselves and protect you as well. And third thing is, it's better for you to make a medical list. I mean, just to get to know before you leave, check with the status of your destiny. Do they still in a very high patient volume, or do they in the public health burden or not? Once you got caught, or once you are, let's say, your relative got caught, make sure that you have something which is safe and convenient to drop by. So that is my suggestions.